Free NCLEX RN practice questions Quizlet. Question 1. Set 1. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin. Check the blood glucose level. Give 15 g of simple carbohydrates. Notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 2. Set 2. HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells. Question 3. Set 3. What is the primary characteristic of anorexia nervosa? Binging and purging, distorted body image and self-starvation, excessive sleeping, fear of spiders. Anorexia involves a refusal to maintain a healthy weight and a distorted perception of one's body. Question 4. Set 4. Which medication is used to treat a suspected opioid overdose? Naloxone, flumazenol, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist. Question 5. Set 5. Which sign is a hallmark of pyloric stenosis in infants? Green diarrhea, projectile vomiting, steatorrhea, abdominal distension. Projectile vomiting after feeding is the classic sign of pyloric stenosis. Question 6. Set 6. A patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 7. Set 7. Which breath sound is commonly heard in a patient with an acute asthma attack? Crackles, wheezing, rhonchi, pleural friction rub. Wheezing is caused by air passing through narrowed airways. Question 8. Set 8. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 9. Set 9. What are the 3 P's of diabetes mellitus? Pain, pallor, pulselessness, polyuria, polydipsia, polyphagia, poverty, pollution, population, pressure, paresthesia, paralysis. Excessive urination, thirst, and hunger are classic signs of hyperglycemia. Question 10. Set 10. A patient with COPD is receiving oxygen. Why should the nurse maintain the flow rate at 1 to 2 L/min? To prevent oxygen toxicity, to avoid suppressing the hypoxic drive, to prevent dry mucous membranes, to save cost. Patients with chronic hypercapnia rely on low oxygen levels to stimulate breathing. Question 11. Set 11. At what age should a child be able to sit unsupported? 4 months, 6 months, 9 months, 12 months. Most infants can sit unsupported by 6 to 8 months. Question 12. Set 12. A client has a chest tube. The nurse notes continuous bubbling in the water seal chamber. What does this indicate? Normal function, an air leak, the lung has expanded, the tube is occluded. Continuous bubbling in the water seal chamber indicates a leak in the system. Question 13. Set 13. A pregnant woman is at 32 weeks gestation. Which sign should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 14. Set 14. Which condition is characterized by currant jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 15. Set 15. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 16. Set 16, a patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding. Question 17. Set 17, a patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 18. Set 18, a nurse is caring for a patient with neutropenia. What should be avoided? Hand washing, fresh flowers and raw fruits, wearing a mask, high-calorie foods. Fresh flowers and raw produce can harbor bacteria and fungi, posing a risk to immunocompromised patients. Question 19. Set 19, which is a common side effect of radiation therapy to the head and neck: diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 20. Set 20, a patient with heart failure is prescribed digoxin. Which finding should the nurse report immediately? Heart rate of 72 bpm, visual disturbances like seeing yellow halos, increased urine output, blood pressure of 120/80 mmHg. Yellow halos are a classic sign of digoxin toxicity.